So the Nest is a remote fetal monitoring surveillance unit, and it is designed to have labor and delivery nurses, real live nurses, overseeing the fetal tracing 24/7.
We were really dialing into our obstetric care and trying to standardize how we deliver obstetric care across the health system. And so in that process, part of what we identified was that we had an opportunity to be creative and transformative in how we deliver obstetric care to our patients.
So the Nest supports 7 member organizations here at the University of Maryland Medical System. It is all of our laboring institutions, right? So any institution that has a labor and delivery, we have Nest support.
Every mom who's in labor, their fetus is being monitored. And so we have access to all of those monitoring strips to be able to see what's going on.
The nurses who are here in the Nest, their entire job is to focus on the fetal tracing and the contraction patterns to try to identify very early if there is a change that could lead to a bad outcome.
We are very fortunate to have PeriGen, which is our AI overlay. I always like to refer to our PeriGen Vigilance system as a nursing support software or virtual nursing assistant, that it doesn't remove the minds of the labor and delivery nurses, but it takes the great minds that they have and allows them to work on a prioritization.
And we're introducing this level of innovation in technology to obstetrics in a way that's really forward-thinking, in a way that's equally and equitably distributed.
So what I think the Nest is really impactful for is kind of recognizing those subtle trends that happen over time that get lost with the busyness of being at the bedside. If you are managing multiple labor patients, if you are managing a patient that's having some complications, it's really hard sometimes to see the overarching trend of what's happening with the fetal tracing, and that's what the Nest does best. That's what the Nest is designed to do.
I'm a mom, and I'm actually a mom who delivered at a University of Maryland Medical System hospital, right? And I can think back of being a mom and feeling very vulnerable. My child had some issues while I was laboring, and to know as a mom to have that extra layer of support, that extra eyes watching, would have been very reassuring to me.
We talk about transforming healthcare, and this is transformative healthcare at its finest.
We have a cumulative 255 years of labor and delivery experience as part of our team of 17 nurses, and it enhances the care for every patient.
Nobody should have to leave their community and drive, to another county, another city, to be able to have access to high-end evidence-based medicine. Making sure that we're meeting patients where they are, meeting our Marylanders where they live. I think it's so key.
I think the value is that moms that come, families that come to our hospitals can be ensured that there's always an extra layer of safety for their care. I think the other big component is the partnership we have with our bedside teams, that they know that they always have a partner when staffing is tight or the unit's really busy or there's just an emergency happening, that they can feel like there's always somebody, may not be in their unit with them, but always somebody that is there and watching and can just provide that virtual support.
The way that they advocate in the setting of change and adversity and continue to persist and continue to show up kindly. We're here to challenge the status quo. I think our team is the face of change.